My mom has always suffered from obesity. She has diabetes. She's developing some of the other complications of obesity, hypertension, some microvascular disease. And I've always wondered if there was something more we could have done to help my mom prevent her from developing these complications. So I specialize in bariatric foregut and endoscopic surgery. And so I pretty much see patients who come for various foregut diseases, paraesophageal hernias, or primarily for bariatric surgery or weight loss surgery. The first thing I want to learn about the patient is their obesity history. When did their obesity start? Did it happen gradually or rapidly? What other associated diseases do they have? I usually meet them, anytime from 3 to 6 months before surgery. As they're going through our obesity clinic, they're seeing psychology, obesity medicine, and nutritionists. And from there, we do surgery, and then I follow them potentially for years afterwards. I think the Cleveland Clinic has a great approach. The patients always have to see a bariatric surgeon, but they also have to be really engaged with, dietitians, obesity medicine, and psychology. After bariatric surgery, there is a specific diet that they have to follow. They have a smaller stomach after a sleeve or a bypass, and that will lead to some dietary changes. So it's important for patients to get familiar with that and to know the whole process. From that day on forward, they'll start losing weight. A lot of their comorbidities will improve, things like diabetes, sleep apnea, PCOS. And it's just very rewarding seeing patients who come to surgery eager and wanting it. One other area of practice that we're heavily involved in is treating gastroparesis. One of the main procedures that we do is called the GPOEM procedure, or the gastric peroral endoscopic myotomy. So patients with gastroparesis, their stomachs don't empty well, and that can happen for various reasons. Approximately 70% of patients will see dramatic improvement after that procedure. Procedures are done very quickly. It only takes about 15 or 20 minutes, and patients go home the same day. In Cleveland, I've been spending a lot of time exploring the city. There's a really nice beach. Edgewater Beach is really nice in the summers.